To kick off our session, it's my pleasure to welcome Sean Graglia, Marketing Director for Alencia XR, who will guide us through today's session. Over to you, Sean.
Thank you, Adam. And thank you, everyone, for joining us today. A warm welcome to returning friends and new connections that we're making today. We often talk about the real pressures faced by anatomy educators. Dissection remains a cornerstone, but access is increasingly limited and costs are rising. And at the same time, the students coming in expect technology-enabled, engaging learning experiences. For osteopathic programs, the challenge runs even deeper. Students not only must master anatomical structure, but also connect it to function and movement. That's a foundation of osteopathic medicine. So today, we'll hear from our guest about how XR is being integrated into their osteopathic program to address these challenges and what the impact they see having on faculty and students, and the advice for anyone considering this path. So let's go over the agenda, and I'll introduce my guest. Following these opening remarks, we'll dive right into the interview with our guest today. After the interview is complete, we'll have some time to address any questions that you may have raised through the Zoom Q&A feature. Then we'll wrap with a few insights on where to go next in your own journey. So let's welcome our guest today, and a pleasure to introduce Dr. Amanda Troy, Chair and Associate Professor of Anatomy at Duquesne University College of Osteopathic Medicine. Dr. Troy has responsibilities for both teaching anatomy and neuroanatomy to first and second year medical students, in addition to graduate students at Duquesne. Welcome, Dr. Troy.
Thanks, Sean. Thanks for having me.
And I'll just pause my screen sharing so we can see you a little bit better. There we go. And, let's start off kind of diving into why mastering anatomy is important to osteopathic medicine. I mentioned earlier, I'm going to understand that structure function is absolutely critical. And then looking back at the traditional methods used, where was the opportunity for technology seen initially?
Sure, yeah. So osteopathic medicine, for anybody who doesn't know, they add on kind of an extra technique called the osteopathic manipulative medicine. And so with that, students are taught how to palpate. They are taught how to kind of take what they know about anatomy and adjust it, manipulate it. So for instance, there's a couple of different techniques that focus on muscle energy. So you have to really understand where all the muscles are attaching in order to either lengthen them or shorten them, in order to get them to release back to their normal position. Fascia is another really important anatomical structure in osteopathic medicine. We have the technique that we use focused on that is myofascial release. And again, understanding how it's connected across different body systems and how it's integrated around all of structures, around muscles, around individual nerve fibers, and knowing how to manipulate that appropriately. So if you don't have a good grasp of anatomy, it's hard to understand exactly what you're palpating. So for me as an anatomist, I love it. It means I get to go a little bit more in depth. We jokingly say that PhDs tend to go far too in depth into their field, and I don't have to worry about that. I get to talk about anatomy as detailed as I want, and well, students might complain, but rarely do they complain because it correlates to what they're learning in their OMM courses as well. So from that perspective, I love being at an osteopathic school. I will say we still do head-to-toe dissection. So our students come in their first semester, and thankfully we have donors that the students get to engage with, learning not just the anatomy there, but also learning about differences between bodies, anatomic variation, how pathology can present itself just from an anatomy standpoint. But what we've done with incorporating new technologies is after they've done their head-to-toe dissection, the students come back to us and we have what we call a HoloAnatomy lab. So with the HoloAnatomy, This is where they get the lenses on, and they still get to engage with the 3D anatomy. It's not, I love Netter. I will use Netter images any day and all day to teach from, to engage with students with, but it's only 2D. And so the HoloAnatomy affords us the opportunity to get the students into the lab and see these 3D holograms. The other important piece of it is they can still work in groups. And so they're still learning that communication amongst their colleagues and amongst the anatomists as we wander between groups. So it's still giving them that engagement piece, but also that 3D anatomy piece. Along with that, we also use ultrasound and radiology. So they're kind of getting a great mix of different technologies kind of in their second pass of anatomy. So I guess that's a brief overview.
It's good. It's a good understanding of how multiple technologies are used to draw the best understanding of the spatial relationships that you were talking about, and what we'll go into a little bit more on HoloAnatomy enhancing that. It really strikes me as the importance of understanding how the structures work together and be able to see everything. You had mentioned early needing to be able to see and understand, and that's one of the challenges that's come up in previous discussions as I've learned more about anatomy from folks like you, even going into this call. So can't see every structure, and so there's an opportunity there to use a different modality to actually see things in a different way. But of course, all this technology comes with change, and I want to dive a little bit into the change and then how you're using the technology. When you decided, Duquesne University decided, okay, we're going to try this new XR immersive experience in learning anatomy, HoloAnatomy. What happened with the change? How was it adapted and how did faculty take their curriculum and make it work together? Can you talk a little bit about that?
Sure, yeah. So the nice thing, so Duquesne is it's a new school. We're in our third year of students. It's our second year of the medical school. So I actually had the luxury, my first academic year here, to really spend time with the technology and figure out how to incorporate it fully. So we use this HoloAnatomy XR technology exclusively for the lab component of our master's program for anatomy. So I was able to build my lectures and then take my lectures and set it next to the HoloAnatomy software and start building labs that correlated directly to my lectures and make sure that I was showing them the 3D relationships and make sure those little things that sometimes get lost in donors, I can enlarge them and make sure that they show up better for the students so they understand those little connections. So I was able to actually side by side build the technology or build the labs for my students so they directly related to what I would be talking about in lecture, and I could tailor them to questions that I was getting from students during lectures or in emails. And so everybody kind of got a 3D visual of a lot of the questions that were coming my way, as well as just the anatomy as a whole. So I was lucky that that was my first academic year. That's what I was able to start playing with. And so when I started bringing faculty on, my team was excited to try new things. They're diving into AI things. And so having this new technology to start experimenting with was nice. I had already built something, so it gave them a chance to try out different things. And if we found that it didn't work, we already had like a backup, which was nice. But my team has been great. They've been excited to jump in. The students are always, the first time they put the lenses on, it's this, I love the reactions. The first time somebody puts a lens on and actually sees a skeleton or sees the heart and gets to stick their head in it and actually see internal structures. So it's the reaction is just amazing. It's so fun. So the students get excited about it. It's a little cleaner than the gross lab. So definitely something that they appreciate, not having to wear specific clothes and don, goggles and gloves and whatever other protective equipment they might use in gross lab. So they do appreciate that, which is why we do it second for the medical students. We don't want to start with the clean and then hear them grumble about, oh, I gotta have scrubs. But it's been a nice transition for the medical school because it's the second piece of anatomy, the second time we're seeing it. It's been a lot of fun. We've had a lot of fun developing different activities. We've done case challenges where the different lab groups compete with one another to work their way through like board style questions, and all the answer choices are just marked on a hologram. So they have to figure out what they're looking at and then apply what they're looking at to the question. And so they work through that, and there's usually candy or some other food for the winning teams. We've brought clinicians in and they've walked them through a case presentation, and then we've shown them how the anatomy applies to that specific case. And then we've had OMM come in and we've shown how the anatomy and OMM correlate with one another. We've incorporated embryology into the lab, and so if this were what didn't develop right, if we lost this structure, if this structure wasn't fully formed, right? So we're able to bring other aspects of anatomy into the lab, even histology, talking about where histologic changes occur. So it's been a really great resource, especially because you can put images behind the hologram. So you can incorporate anything you want to guide whatever, if you have a relevant MRI or other radiograph that you want to put in, or maybe an ultrasound image, or a histology slide, right? So you can incorporate a lot of different things with it, which has been really a lot of fun. We've had a lot of fun creating different types of learning activities using the HoloLens to apply anatomy in just different formats.
It's interesting. You unpack a little bit about what you were just talking about. One of the things I heard loud and clear, and I hear this from other folks as well, is the empowerment that you had as an educator and the lead to curate what exactly you wanted students to see. And it sounds like that was a very important aspect of the solution. And you also mentioned the ability to actually show structures in a different way that might not be as normal as we might expect. That also comes up a lot. It's part of my own learning experience as I hope to become an honorary anatomist, was understanding that not every body is exactly the same. And so that's why when they created HoloAnatomy at Case Western Reserve University, they meticulously drew out a good representation of male and female bodies so that you could choose what you wanted to show it and whatnot. It's great to hear that those points are resonating. And what I really liked, as you mentioned, is the fun. You sounds like you've made learning fun using technology, and it sounds like the students are really reacting positively to that.
Yeah, we have a lot of fun. Students, I think, are enjoying it. I think as they get closer to boards, they're wanting to change gears and do that, but that's anywhere you go. But the master students are loving it, and our students are, when we do the challenges, they like the challenge, right? They like the competition. So we try to throw that in every now and then to give them that competition. And yeah, they're engaging with it well. They know what to expect from us, because we always assess. We still have assessment built into this. And one of the nice things is they know what to expect from us. So I think that helps as well. We don't hide anything. We're not trying to trick them with it. We just want them to have fun in the learning. And then they found that they actually remember more than they think they do.
That's also come up in conversations I've had where there's an opportunity to actually explore the structures before they go into a lab. And that way, when they go into the lab, they kind of know what they're looking for. And then some students, I'd be curious if this happens at yours, actually go back to HoloAnatomy and understand, well, what did I just see? Do you see that type of reinforcement happening?
We do. We get it kind of on a big scale with the master students who matriculate into the medical program. So we have kind of two different cohorts with our first and second year students. And that's the one thing they say, going into the lab after having a full year with the HoloAnatomy is really, given them a strong foundation and given them confidence in lab and in lab discussions. I make a point to make sure they're kind of spread out throughout the lab and not at the same table or at the same donor with one another, to kind of encourage them to share what they know, what they learned previously with us. So we're seeing that kind of on a big scale, just more confidence. And then for the students who've never had it and they come into the HoloAnatomy after seeing it in the cadaver lab, it's that sometimes you hear these comments, oh, that's the relationship they were talking about, or that's what they wanted me to see there. And so we hear comments like that as we move through each of the body systems. And so I know that things are clicking with the opportunity to come back to it after the gross lab for sure.
In talking about the gross lab, the other learning that I've had over the past little while is understanding what goes into preparing to go into that lab, being a part of it, what you're around, and then leaving. And it sounds like it takes a lot of time. So I'd be curious to know, do you see a positive impact on the time that students are spending, where they're actually spending more time learning than actually preparing?
Yes. A lot of what the gross lab is, I mean, they have to do the dissection, and a lot of the learning is going to happen in the dissection, but from a student standpoint, they don't recognize that when they're there in the moment.
Mhm.
And there is a lot of prep that goes into it, and they have to come back after hours and review what they dissected again. Whereas with the holo, a lot of that work, what they think of work and not directly learning, if it's not already pre-prepared for them, then they don't think they're learning. So it's been nice, and as we move into body systems where we have less time for them to dissect, they can come and we already have these pre-planned activities, so they're directly engaging, and they're not doing a lot of the learning prep that they might do in the cadaver lab setting. Um, I will argue, though, that the cadaver lab is one of the most important modalities, but as you mentioned at the beginning, it's becoming harder and harder to secure donors. So it's been a great and fun alternative for us, just as the educators and for the students.
I'm glad you mentioned it. We find with a lot of schools, it's meant to be complementary. It's a good, it kind of amplifying each other and making best use of dissection resources that you have available to you. There are schools that we work with that just can't afford to have a program like that, and it works there well. But absolutely, thank you for sharing that. And it sounds like there's been a lot of positive experiences with the students. Sounds like there's been a positive experience with the faculty. When you think about advice to other programs, what advice would you have for them to have the same sort of outcomes and experiences? Anything that you've experienced that you'd like to share?
Sure. So one of the things, everybody's a little nervous when they look at putting a headset on. A lot of different problems can come up, from get headaches, maybe you have issues with vertigo, things like that. And one of the nice things about the HoloLens or the MetaQuest is they have a pass-through option. And what I mean by pass-through, instead of being in a virtual world, being in a virtual space, you can actually see the room that you're in. And that often mitigates a lot of the technology related issues that people have putting these lenses on. You can actually keep your glasses on, which, as someone who's blind, that's a nice thing. I don't have to throw contacts in if I don't have to worry about it if I forgot them that day, which is nice. Not all lenses afford that feature, but I like having the pass through. I've worn these headsets for multiple hours and totally forgot I was wearing them because I can see the space. I can actually see the people that I'm working with. We're all looking at the same hologram. So that would be one thing. If you're thinking about a technology like this, consider something that allows you to stay present in the space that you're in, because it will mitigate a lot of those problems. I do like that they can see one another and the hologram. So they're still interacting with real people and pointing at a hologram that's in the same space. So it's like they're interacting at a dissection table with one another. without actually being at a dissection table. So they can see one another, they can bump into one another if they want, usually on purpose, um, and still see the hologram that they're working with. So.
Great advice. And when you look at the change management, did you find anything that particularly useful in making sure that the faculty in particular were comfortable with the technology?
Just getting in there and
Yeah.
using it really. It's nice to see what you're creating for the students. So that's one thing that we've always done, myself and then my team now. When we create something, we like to look at it before we put it in front of the students, and we'll all check one another's work and, did we cover everything? Does it make sense? Does it flow well? Can you actually see the structures you're highlighting, or do we need to take something off? Or you can fade things, make them transparent so you can kind of look through something to see the layering. So are all those relationships that you're really trying to point out, are they still there? So that's the one big thing I recommend, especially while you're getting used to it. Put the lenses on, build a slide, publish it, and go check it out in real time and see how you like it. You have to do that less and less the longer you get used to it, but definitely play with it.
It's great advice. The one thing, having spent the last 5 years in XR technology, I found is you don't really understand it unless you use it. And you mentioned the mixed reality, which is a strategic decision that was originally made for HoloAnatomy and continued on the .next platform with MetaQuest 3 to be able to collaborate. And it's a vastly different experience than a virtual world, as you well know. And the best way to experience that is to actually try it, which I'm glad you mentioned that, and being able to see how you can curate something on the desktop and actually put the device on and see how that transforms and tweak and whatnot. Very good. I know we could continue this discussion a lot, but before I go to questions, you're about to leap into teaching with this technology, aren't you, in a few minutes?
Yes, I am.
And that is uh, uh, one of your presentations that you've already set up as you were explaining, using the desktop tool, and everything's all just set up so that you can just walk in there and guide the students through their experience. That's what we were talking about earlier, right?
Yep. So
That's very good.
I put together a little guide for them that walks them through each of the scenes that they'll go through. And it directly relates to what I've given them in lecture and reviewed with them over the last, well, they had fall break last week, so it was the week before that. So we'll see how much they actually studied over their fall break.
It was the week off. Well, I hope they're ready for an exciting dive right back into its session. So let's see if I'm sure we have a few questions from the folks joining us, and they'd love to hear from you. Adam, I'll ask you to join us back in. And is there anything that's come through in the Zoom Q&A that we'd like to ask Dr. Troy?
Yeah, we have a few questions. Thank you, Dr. Troy. It's always great to hear from you, speak about HoloAnatomy and how things go in at school over there. And I wanted to first start with a question. How did you map XR sessions to course content and objectives?
Sure. A lot of it is, I just sat down with my lectures, and the goal of the labs is really to augment what we're doing in lectures, to give them, to highlight more of the key relationships. So a lot of the learning objectives that I use, or even course objectives that I use, are just kind of I dive into them maybe a little bit deeper and more directly with my lab sessions, because I do kind of build them, or I built them side by side, to make sure the lab complements the lecture quite nicely. So they're really kind of the same, maybe a little bit deeper dive for the lab component.
Great, thank you. And then I hear this a lot, is how are we able to get funding for this? So there's a lot of schools have different budget systems. Do you have any advice on funding opportunities such as grants or partnerships that can help support adoption of HoloAnatomy?
Maybe a little. So funding is sometimes you have to look for it. So that would be one big thing. Like if this is something that you really want to do, the nice thing is Alencia will come and do presentations. They will come and show. We actually just recently hosted an open house here on campus, and we were able to invite some of the local universities and some of the high schools in the area um, to show them the technology. I was able to create some great connections. That is one nice thing about this technology is it's great for community outreach. So I'm working on developing a program with one of the local high schools that came for that open house. But get Alencia there on your campus to do a presentation so you can make a case for it. Because sometimes it's the people with the money need to see it. They need to experience it to want to buy into it. But the other thing is look for money. A lot of local organizations want to support this, and a great way to maybe, I hate to use the word spin, but that's what's coming to mind. But a great way to spin this is that it's for student education as well as to create those community connections. And maybe you can create a program for a high school that's underserved and doesn't have access to a lot of this technology. You can bring the technology to them or bring them to the technology. And so a lot of organizations like to fund things like that. So definitely look broadly, but my one big recommendation is get Alencia to come out so the people with the purse strings have a chance to see it.
Certainly appreciate you sharing that, Dr. Troy. It's a question that comes up quite a bit, and one of the interesting notes that I've gotten from schools is at an event where there's donor alumni and being able to showcase the technology so that they see what they're buying into and they see they're enabling the future, and it's tied to better outcomes. It's real. We've get a lot of feedback that happens as well. And it doesn't hurt to some of the schools I've talked to as dignitaries going in and use this as a showcase event and whatnot. So very, very good advice. Thank you. Adam, do we have time for maybe one more question before I know I need to let Dr. Troy get prepared for her upcoming session?
Yeah, we have one more question here that has come in. Who owns the technology and content updates?
Well, I guess who owns it would be like the content. What we build, we own. It's in our server. Um, we get to reuse that. We get to kind of chop it up for different things, however we want. So you build it, you own it. That's the nice thing. I will say within the community, especially I was alone when I started using this. I was the only anatomist here, and thankfully, the HoloAnatomy community is it's much like our anatomy community, very collaborative. Um, well, it is our anatomy community, and we are very collaborative. And so I had a couple of great people that I got to know that helped me kind of figure out how to get things started. And so we share things across institutions as well. So there's if you need something, you need help with something, reach out and people will help that way. Um, our IT department is really good about keeping updates regularly. So Alencia is always looking to get better. It's always looking to improve the software. So they have regular updates that will come through. The nice thing is they never disrupt what you're doing. Um, they just kind of improve once you upload the updates. They just improve what you've already built. So nothing's stuck in the past. Everything kind of moves to the new format. And so you'll get new features, whether that's movement or other kind of new features that they're adding in. But IT for us is doing a great job of keeping that updated. And I have a wonderful lab technician she's amazing. So lucky to have her. So she keeps our lenses up and going for sure.
It's so nice to hear the strong relationship you have with your technology team. Out of a career of technology, the one recipe that keeps coming up is that strong between the program or the business and the technology team. And it might start out, and hopefully we have a few anatomy educators on the session today, where this is your idea, you want to improve the learning outcomes as technology is needed, and somewhere along the way, you'll want that relationship with the technology folks so that they can make it easier to deploy, for example, the MetaQuest 3s and have them maintained and whatnot. And I love the relationship that you've built with them, Dr. Troy. Awesome. Uh, I think that will wrap us up with the formal questions today. And I just want to thank you, Dr. Troy, for sharing your valuable insights. And it's really every conversation we have and we share with folks is a very enlightening conversation. So thank you very much.
Of course. And if anybody has questions further for me, feel free to reach out. I'm happy to talk about this more in depth. If you want a little more detail, please don't hesitate.
Awesome. And I'll let you turn your camera off, where I'll share a few final thoughts about the folks that are on the session now of where you might want to take this. So a lot of what we've been talking about today is about leveraging technology to actually reimagine anatomy learning. And at LNCSR, we've taken this to heart with the creation of the .next immersive learning platform, which now underpins HoloAnatomy. We've actually built that on a foundation established at Case Western Reserve University, and it reinforces three core benefits that I'll share with you. First, it enables instructors, and you heard this, to design customized lessons and labs, combining their own content, even adding their own 2D and if they would like 3D content, along with the HoloAnatomy library. And then both normal and abnormal anatomy can be included. And you heard that from Dr. Troy in our conversation we just had. And that way, physiology, histology, and even clinical cases can actually be presented and understood and learned in a single session. The second thing it does is it brings learning to life. And you heard some of that excitement shared by Dr. Troy. Multiple learners and instructors interact with the same holographic body in the shared XR environment. It's a shared learning experience that can happen on the MetaQuest 3. And these structures can actually be isolated or arranged or manipulated for regional dissection or the group learning. And the third thing is the offering unmatched clarity. And we talked a little bit about this in the session today. Our color-enhanced anatomical models have been meticulously hand-drawn by experts to be precise and visible and representative. And this helps students truly see and retain those complex relationships. So the library itself actually comes in two packages. HoloAnatomy.next supports gross anatomy, and it has over 7,000 structures across 15 male and female systems. And then HoloAnatomy Neuro.next delivers the most detailed 3D neuroanatomy available. Those two packages. And so using those and bringing those to your classroom or even individual remote learning, there's two apps. There's the hub, and you can think of that as the command center for immersive learning. That's where folks like Dr. Troy and her team customize the lessons and integrate their own content with ease. That's the desktop tool. And then the XR Viewer tool, which runs on MetaQuest 3 and runs on Microsoft HoloLens, delivers those life-sized exploration of structures, dynamic interaction, and real-time collaboration. So as you continue exploring what's possible for your program, I wanted to talk a little bit about the three steps that I think you can take. And first, I would encourage you to explore our website. There you'll find details of the research that we talked a little bit about, more in-depth stories about partners that we've been working with. And then webinars like these are a great way to gain insights directly from peers and people in the field. And so I'd encourage you to take a look at past webinars that we have. And while the programs may be different from the one that we talked about today, the challenges are common, like the ones that I talked about at the beginning of the session. It's all about helping students master anatomy and leading them. And so when you're ready to explore how your own program can achieve some of the similar benefits that we went through today and talked a little bit about, we'd welcome the conversation. You can feel free to reach out even in the chat today about anything that you'd like to cover. But there will also be a survey, and you can fill that in and let us know that you'd like us to reach out. We'd be glad to help you discover what's possible for your program. And so this concludes the formal presentation. We enjoy bringing the insights that we discussed with you today. And we recognize the challenge that you face as educators, trying to navigate this accelerating technology, really on the path to what everyone wants is better learning outcomes. And so Alencia XR would like to offer you our deep expertise in immersive learning and help you navigate this technology to those better learning outcomes. So after the webinar, you will receive a survey when it ends up. Really appreciate your feedback and any recommendations that you'd like to see in the future sessions. And then you'll also be receiving a follow-up email in the next 2 days with a link to the recording and any of the material we discussed. So I'll thank you for today. One more thank you to Dr. Troy. I look forward to, and we look forward to continuing the discussion with you.